Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Yeah, good morning, everybody, and welcome once again to another edition of, what do we call this?
For the Health of It.
For the Health of It. You know, it's pretty bad when you get old and you can't remember what the heck your podcast name is. For the Health of It, Cowley County. This is Tom Langer, the Health Department Administrator and the county's Public Health Officer. And with me, as always, is my assistant, Allie. Allie, how are you today?
I'm okay.
Good. Can't believe that we're so far into summer, we're already starting to think about fall.
I know, that's crazy.
That's nuts. You know, summer's always been my favorite time of the year, and on this podcast, we've got a couple of special guests with us today to talk about things that are going to be happening or that are important as fall gets a little bit nearer, and it seems like it comes sooner and sooner.
Time flies when you're having fun.
Each year, yeah. I always talk about being the dinosaur, you know, how back in the day when we went to school, school year started end of August. I mean, you had a couple of days where we would go because it was so hot. And then Labor Day would come, and then after Labor Day, it seemed like that was really the start of the school year. But we didn't have breaks in between other than just the set ones at, you know, Christmas and things like that. And then we'd go to school till the end of May. And that was the school year. And it's changed so dramatically in my lifetime to see how soon the school year starts, year in and year out, and what it does. And we at the health department are uniquely tied to that, aren't we?
Yeah.
Because, we talk about all of the things that we have to do to help families get ready, especially keeping their kiddos ready to go with their required immunizations and everything else. But there are so many other programs that exist out there. And today, on this episode, we're going to be actually talking about some of these programs. One of them is going to be Head Start, and the other one is Parents as the Child's First Teacher. And with us today are two of our colleagues, Alisha Call, Alisha, what is your
I am
title?
The Director of Communications at ARC City
For 470.
Yeah.
For 470. I know, because we always, the names appear on all of those press releases. And also, we have with us Tara Taylor.
Yes.
And Tara, tell us and the people in the audience what your role is and what your title is and what you do.
I am the director for the Head Start grant in Cowley County, and we have classrooms here in Winfield and also in Arc City.
Okay. So those are the two folks that we're going to be talking with today. And part of it that we're going to be talking about, or what we're going to talk about, is exactly what Head Start is, Parents as the Child's First Teacher, what that is, and some of the fun things that go about it. Right?
Yeah, sounds good.
All right. So I'm going to ask you a lot of questions. I'm going to talk a lot, but I'm going to ask you to start out. I'm going to start with you, Alisha, because I know, tell us a little bit about what your role is, how long you've been here in Cowley County, and all that good stuff.
Sure.
Okay.
So I am the Director of Communications for ARC City Schools. I've been in that role now a little over 17 years. I'm a hometown girl, so born and raised in ARC City. Left just long enough really to go to college and came back shortly after. We've got a lot of cool things coming up this school year that we're excited about. It's hard to believe that it's already time to start thinking about that. But yeah, we're happy to share about that today.
Since you started this off, I'm going to ask you a couple of questions. 470 is really one of the largest, well, it is the largest district in the county.
Yeah.
In general, how many students do we have?
We have approximately 3,000.
Yeah, that makes a pretty good size.
Yeah.
What are we classified as? Are we a 5A?
5A.
5A school.
Mm-hmm.
And so, that's considered the big boys,
Yeah.
even though we are in a small, what I consider small communities.
Sure.
And because of that, you have a lot of the programs that we would see in the larger metropolitan areas. Okay, so that's kind of a unique thing, and I think 470 is blessed in that regard. But you guys have kids from all over the county come into the district, don't you? Because with the open enrollment, or am I mistaken?
So that's a possibility. Yeah, we actually only had a couple of students apply from out of district this year that
really?
hadn't
Okay.
already been doing that. So we always have some staff, children who come to school in our district, but this year we really weren't affected too much by that open enrollment policy.
Student populations continuing to stay pretty constant in the Arc City area?
Pretty consistent. We've gone up a little bit, but nothing of real note.
So I'm going to ask a question now because I kind of already know the answer to this one. What's the biggest challenges that we have in the district with the student population?
That's a great question.
We're very diverse is what I'm getting at.
Yeah, sure. We do have a diverse population, so we try our best to really communicate effectively with families regardless of what language they speak natively and regardless of literacy levels and all of those things. So that's certainly a challenge, but we've found a lot of opportunity with that too, and I feel like, made some great strides in reaching and connecting with families that in the past it would have been more of a struggle.
Yeah, I go there on purpose because I know that those things kind of really influence a lot of what we do as well.
Sure.
The programs that we administer in the county and especially in the Ark City office. We have a much greater number of non-English speaking families that we see, and I know that transfers over to the school, and so we always seem to be kind of partnering, and I think we'll be doing something like that a little bit later this year. So anyway, Tara, tell us a little bit about what you do.
I'm the director, like I said, for the Head Start grant and oversee the pre-K programs in Ark City specifically, and then collaborate with Winfield. And we have 30 Head Start spots in the Winfield Early Learning Center. And like Alisha, I have been here in my entire life. Winfield, Burden, Arkansas City, it's been my home.
Define and describe for people exactly what Head Start is, what it means, what it does.
Well, preschool's funded differently than K through 12, and so there are a lot of grants that come together to form preschools. Ark City and Winfield both apply for the at-risk grant through KSDE, and then, like I said, the Head Start grant is another about $1.8 million for our county, and so that requires us to do a lot of extra requirements for federal funding, and so we're happy to do that because many of them benefit our kids and families. And the poverty guidelines help guide and dictate who we are able to accept into that program. And then the at-risk program, same thing. There are at-risk guidelines put out by KSDE, and families meet those guidelines to be able to be eligible for those programs. To my knowledge, in Winfield, all 4-year-olds are eligible to come. We do accept all 4-year-olds in Winfield. And then 3-year-olds, there are some criteria based on those grant fundings and special education needs.
Okay, now, I understood with perfect clarity everything you said, but I speak geek, okay? Let's talk to moms and dads who have no idea about the acronyms or the money, what it is exactly. I mean, Head Start is a program that's designed exactly for what the name implies, to give kids
Absolutely. That early development.
Yes,
early development is so important, and we work with children and families in a variety of ways, one of which is partnering with you guys and some of our local medical providers, making sure that kids have a family dental home, medical home, immunizations in place, and just navigating that is often difficult. We also have an opportunity to help families through our office with Medicaid eligibility. Had some staff members trained through KDHE to be able to help, especially new to Kansas, families get back into that medical card paperwork. It's a lot. So helping navigate that, but also just that early brain development and making sure that we're looking at developmental milestones and encouraging families to look at the CDC milestones. There's a great app that they can put on their phone, and this is what my child is doing. This is what they're going to be doing next. And then always encourage them to speak to their doctor if some of those milestones aren't being met.
What kind of outreach do you do to connect with families, to let them know the programs available and how to see if their child qualifies or you can be enrolled?
Sure. So collaborating with the health department or Department of Children and Families, other area organizations, we do developmental screenings every month in the county. That's through the Cowley County Special Services Cooperative. But Winfield and Ark City and Burden, you can call any of the elementary schools, preschools, and they'll be able to connect families with the developmental screening. And through that screening process, we look at different areas of development, the cognitive, or what I sometimes talk with families about what you think kids are doing in school, so colors and shapes and those kind of things, which is all important. But at early learning, that language development is huge. And we often see that kids maybe aren't developing within their language the way they should, and so encouraging families to talk to their doctors about that. But also, we have a wonderful Birth to 3 organization in the community, Reach. We collaborate with them as well, and they serve children 0 to 3. And language, I'll keep honing in on that because that is the biggest thing we see. If children are not developing language and meeting those developmental milestones, that can impact behavior and frustration levels if we can't speak to each other to tell mom what we need or ask the questions that we want. That sometimes leads to what people think as behaviors when it's really just a language barrier. And then also just looking at their self-help. What kind of skills do they have for dressing and playing with others, social skills, those things that are often a big focus of preschool.
So how many kiddos do we have enrolled in these programs?
Sure. In Arc City, we have usually about 265 3 and 4-year-olds. And again, all 4-year-olds are eligible to come and just participate in normal enrollment. And then 3-year-olds, we do serve students that either qualify for Head Start using the poverty guidelines or a developmental delay such as language, and they need to come in because we have speech paths in the school, and the speech pathologist will help those children and families with those language development skills.
So one thing I kind of want to clarify in Arc City is that all of our 4-year-olds are together in the same classrooms across our elementary schools. So there's no separation of a
Absolutely.
Head Start child and a regular pre-K child. They're all in classes together. They all get the same benefits, the same services, those things.
Absolutely.
So that's, I think, an important distinction to make for our families.
I think a lot of parents probably just, we're in preschool, right? I mean, that's the terminology they use.
Yes.
And I wonder, truthfully, moms and dads or single parents or, however the family is structured, how many times during the course of the busy day that they get, they really understand everything that's going on behind the scenes that drives the programs. And I know that those kinds of questions and screenings and everything else can be so kind of overwhelming to them.
Definitely.
We see that all the time. I mean, we hear it all the time. I don't understand. Why do we have to do this? And we got to fill out more papers and all of that. And the overall goal, though, is to provide the children in the community with absolutely the best opportunities from the very beginning of their educational lives all the way through so that they can, I think, probably develop to their fullest capacity, right, Alan?
Yeah, absolutely.
And again, this goes, I'm having to think way back, on how different things are. Personally, I recall, and now this is going back, early 60s, going to kindergarten roundup with my mother. One of those first memories that, because you're a little kid and you're scared. But I don't believe back then these programs existed, or at least not. It wasn't usually until then we were in school, of starting at kindergarten age, that we had the screenings that we didn't know. We were just playing, or we were eating graham crackers and taking a nap, that kind of a thing.
And really all that screening is just gives the teachers and the speech pathologists, where do we need to meet this child at and how can we help their learning progress? All about school readiness and all about supporting those families to make sure that kids are ready to learn.
I think, Alisha, you hit upon it. It's not about singling any child out.
Absolutely.
It's about identifying.
And we have to do those things because of funding, because it's funded different than K-12. But it's also very important to identify early and receive those interventions. Birth to 5, 90% of the brain is developed, and that's why we're so urgent in getting those children in for screenings and encouraging families to watch the milestones, talk to their doctors. And we have some amazing speech pathologists in this community. And again, language is the biggest thing we see, so I'm going to keep referring back to that. But the speech pathologists have some great tools in their toolbox to help families and children and teachers. They provide a lot of training for our teachers as well and how to develop language. And
what do you find in the district or, with the kids that you work with is the most recurring issue? Is it speech development?
Yeah, for early learning, and I don't think that's just local to Cowley County. That's the biggest thing in early development is that language.
And what are some of the key factors that contribute to that slow development? Or I mean, we see some kids, oh wow, they're talking full sentences at 2, which frightens me to death. And then there's others that can barely, form words at certain stages. But do you see anything in particular as as you look year to year and you see all the data, because we're all about those things?
Sure.
That kind of point out, hey, we have concerns in certain areas that we need to address.
again, that 0 to 5 brain development is so rapid, and 90% of the child's brain is developed by the age of 5. And every child's going to develop at their own rate. And just because your child has a delay in speech does not mean, anything cognitively is wrong. We look at oftentimes things that are impacting that. Could be the amount of time that kids are read to, or the amount of time that they have opportunities to talk with other kids. And I hear parents all the time say, it's just me and Susie at home, and I want them to have experiences with other kids. And so that's what preschool is. We want to play, we want to learn together, we want to practice those social skills, and just be exposed to things we're maybe not exposed to all the time.
So how does this then tie into, you mentioned the parents and their being at home. The other topic or the program we talk about, the parents as first teachers. How do those things tie together, and how do they get involved in something like that? What is it exactly?
Arc City does not currently have a Parents as Teachers program. I know in Winfield that they do, but there are lots of opportunities through like REACH, the Birth to 3 organization. We have another program through Kansas Children's Service League, Parents as Teachers here in Winfield. Any play group opportunities or outings that you can do with your children, obviously, to have them exposed to different activities at the library. And we encourage families to, use all those resources. I know yesterday the public library in Arc City had the Sedgwick County Zoo in for an opportunity for young children.
Yeah, those are neat. I remember going to the libraries a little. Of course, that was before the days when we all had, handheld devices that preoccupied us 95% of our waking hours. So let's talk a little bit about the development of children. This is something that we're exceptionally involved in and concerned about, especially when we take a look at all of the things that we do to interact with kids from the time before they're even born until throughout the entire continuum of their lives. And let's talk a little bit about brain development, okay? Because it's one of those things that I know is important. And Tara, I absolutely concur with you that first 60 to 72 months is so vital, because so many things can happen. They can go wonderfully correct, or they can go terribly wrong if we're not careful. Tell us a little bit about when you guys do, or when you see the assessments. What kind of advice or what kind of guidance are we providing to the parents to let them really understand what's going on with their littles? I wonder sometimes, based upon where we are, if we're getting through, if we're meeting them at that level that we need to have those discussions so they truly understand the importance of what's happening to their kids during that time period.
Sure. So we have family service advocates through the Head Start grant. It's something that's unique to our program specifically, and they really encourage families to connect with a medical and dental home, making sure that, all of those needs are being met. That's, basic needs. That's our first step. And then branching out to that, what are you needing as a family? What are some of your barriers? And then connecting them with community resources. We have a fantastic website on City-Cowley where we use that to connect families with those different resources as well. But just supporting families. I mean, we've been there. I'm a grandma now, so I definitely see things a little differently than I did when I was in the thick of it as a new mom. But just being able to support families, and it takes all of us supporting each other to provide what kids need, and it's worth it.
Tell us a little bit about what some of those developmental milestones are that we're looking for.
Sure. We encourage families to download the CDC Milestones app, and you put your child's birthday in, can add their picture. It's really fun. I have one of my grandchild's pictures on there just to kind of see what it was like as a test. And it's really, like I said, gives you, this is what they should be doing from when they crawl to when they should be setting up and walking. So all the way from birth, and then it gets a little more specific, as they get older. There's also a really great resource on the CDC website about talking to your doctor about the milestones and some questions that you might ask of your doctor. And we try to provide that at all of our screenings. We give a little bit of information about literacy, a little bit of information about health and wellness, and then also how to talk to your doctor about any concerns that you might be having with your child. And really, for little ones that are 3 and 4, it's the social emotional and also those language skills.
Those CDC developmental milestones are the ones that we use in our Healthy Start Home Visiting program as well, from birth to 1 year. And we encourage families to download that app. It's fantastic.
It is. It's a lot of fun.
I think of the challenges that we face at the health department in specifically communication. I've mentioned in other podcasts or in other events, one of the greatest challenges that we face today is something that I never ever had anticipated through my public health career, and that would be that I would be facing a time where we would have the most advanced technologies that we've ever had, in our lifetimes, but that we still cannot communicate with people because they don't speak the same language that we do, but even more importantly, because of the fact that they are not functionally literate in their native language. And so we struggle greatly sometimes in being able to communicate why these things are so important, specifically to newcomers in the communities that we know are having children. We see them, and we know they're coming your way. And I'm wondering, how are you guys dealing with or trying to cross that barrier that we already have and we've been having for a number of years now? As communications director, Alisha, I'm really curious about what the district's doing, and then Tara, how is that working within the programs?
Yeah, so we've really made a big effort the last couple of years, especially to do everything we can to meet those families where they're at. We started having what we call an ESL open house every year in the fall, right after school starts. We invite the health department to be a part of that also, as well as some other local resources. And that's really an opportunity where our amazing bilingual staff willingly chip in and they help communicate with those families right there in person. We provide them all of the materials that they might need and kind of put them in contact with those various community partners like yourselves, where they can find additional information and get the services that they need. We try to translate everything, and we try to do a lot of in-person communication and over-the-phone communication, again, utilizing our bilingual staff that we're so fortunate to have. We're really trying to do that, and I think working together with community partners where we're all really trying to do the same things, that's been such an asset that we're all saying the same things. They're hearing it multiple places, which I think ultimately will be a big impact.
Are we seeing parents engage?
Oh, absolutely. Parents want the best for their children, and they're just reaching out to us to help get there. Another thing I will add is our staff members that are able to speak Spanish now has dramatically increased, and it's exciting to see them get excited about that. We have preschool classrooms where kids are given the opportunity to have the happy birthday song. Do you want it in English or Spanish? And a majority of the kids pick Spanish, and the bilingual aspect within our classrooms has dramatically increased, and I think it's fantastic for all of us to branch out and to be able to communicate in both languages.
Allie, what do you think internally? What percentage of our clientele, especially in, say, the Arc City office, is LEP?
Oh, I would say probably 30%.
30%, yeah.
And that's pretty accurate with our students also.
That's an astounding number when you consider it. I know that's grown considerably in the 9 years that I've been here. It was always there, but it wasn't bad. But what we've seen, like say, dramatically shift are the newcomers that are fearful. They don't want to draw attention to themselves, and I don't even want to get into the politics behind that, because I'm more concerned about the families, the health, the what our people in the county are going to be going through. And so that's important to why too we're engaging, and we've got the partnerships that we do, because we realize that they will be sending the kids to school, or at least we hope they are, but we also kind of look at this to help us identify, are we seeing all the families? Are the kids being fed appropriately? That's been a big issue. You can't start anything out if you're not nutritionally fed correctly. You're not going to grow. You're not going to develop. And we're so happy that we've got the districts that can provide meals for kids and these programs that do that, because we're talking about basic human needs at that level. We're not talking about, well, what kind of shirt or shoes am I going to wear that day? Now we're talking about kids that are they going to be fed before they show up in a classroom, and what's that going to do? And we see it. I know you guys have to deal with it.
We have a lot of unique opportunities to connect with families, especially at the pre-K level with our family service advocates. And all summer we've been doing enrollment, and those are one-on-one. We really get to know the families and understand, where they're coming from. And we learn, a lot from them as well. They have a lot to provide, both in our classrooms, and then also we've had some that have been employed by the district, and they are a great resource and asset to our programs. But parents come in to share their culture with our kids in preschool, and I'm only talking about preschool because that's my area. It happens across the district.
That's where it begins. Then,
yeah, absolutely. And just those meaningful relationships that we're able to build with families through that enrollment process and that screening process, and helping them navigate our messy paperwork nightmare for most of the things that you do and we do. That's difficult for all of us.
I do think that personal relationship is really where it starts. If you can garner that trust and rapport with any family, you're more likely to learn more about them and how you can best support them. And then through that, you can share all of those wonderful resources that we have.
One of the things that I've, throughout my career, been exceptionally concerned about is environmental health and how it impacts families, because a lot of times they don't realize it. Yesterday we were in a meeting where we heard from a pediatrician his concern about the conditions that families live in and the exposures they have to so many different elemental things, the cause and effect, the poor air quality that leads to the development of asthma and chronic conditions in children and families. And then, of course, I hate to say this, my teeth were cut in public health on lead poisoning. And I'm probably one of the most concerned people about that, because I see all of the conditions in our county, the older housing stock, the influx of young families that take those because that's what's available or what they can afford. And then we see it through the screenings that we do, the results of kids coming out with higher than normal blood lead levels, and then the investigations and such, and the interactions that we have to perform with those kids. Let's talk a little bit about that and why it's kind of important, because I don't want to climb way up on that soapbox and preach because, it's just Tom going off again. But I realize how important it is, and if we can kind of as a group explain to others why they need to pay attention, because these are lifetime things that could affect a child.
Absolutely. We, as you know, have worked with the health department over the last year and a half. Because of our federal funding that comes through the Head Start grant, one of the requirements is that kids have the blood lead levels, and I believe it's also for the Can Be Healthy screenings. And so I know you guys, until recently, were about the only place in the county that could do those. I think one of our medical providers now has the capability of lead testing within his office. But we, as a pre-K program, started noticing those high levels coming back, and wanted to know, now what? What do we tell parents? How do we help support them? And just the awareness and being cognizant of the effects and the impacts that can have on a child's development. I don't think even those of us that were in the program at the time reading all the research were fully aware of how impactful that can be. And any amount of lead in a child's blood is not good. I think the CDC recommends less than 3.3.
Yeah.
Yep.
So it's sad that I know that, but we've done a lot of research about that. But it can cause developmental delays. It can cause problems with hearing and speech, learning difficulties, attention. And so I think that, again, just making sure that kids' basic needs are being met, but also that's why the medical and health things are so important, because if the child is having difficulties and it is related to lead,
right,
we have to do something about that.
And we try to be on top of that as much as we can, And one of the comments we heard in this listening tour, I guess you could say, that we're on, which by the way is connected to the health needs survey that has been done in the county, and it's continuing, through its steps, was the realization that these types of activities and services have been severely underfunded through the years. That one of the things I talk about is that we're still battling an issue that has its root cause based in what people did over 100 years ago. And it just keeps going on, and it affects generation after generation after generation. And the understanding that I don't know that we'll ever truly, completely eliminate it unless we have some kind of drastic natural disaster that wipes away all the housing and we have to rebuild with new stuff. But it is so prevalent in our environments. All of us face those risks. This is a really kind of funny. It's not funny. We live in a house that was built in the 70s, early 70s. And the wife and I said, actually it was more the wife who kept telling me, we need new windows, we need new windows. And so we're finally getting the windows put in, and it's been a long time now. I don't look at my house as being old. But when I said, built in the 70s and it's 2024, it's, yeah. And we know that, and the contractor comes up and hangs the little signs on my door, and I chuckle because I'm like, yeah, I know all about this, and we don't have littles in the house at all. It's just her and I now, but it's a stark reminder of how it's everywhere. No matter what, I know some of the doctors have bought all of these nice houses and they've renovated them, but it's all still there. You go up and down Main Street, or you go to some of the areas, and the nicer homes, they're old, that have been done, and that is something that's still with those properties because it's never truthfully gone. And you were going to say something.
Yeah, just the awareness piece of that. Some of us, again, in the program, when we started researching why are we doing this lead test, didn't know the impacts, didn't know where that was coming from. And so, yes, your house, your soil, mechanical
jobs,
shops,
hobbies,
different jobs
things that we do.
Yeah, absolutely. And you're bringing that in your house. So this Know the Facts that you guys shared with us from the CDC website also goes in all of our screening packets now. We do talk with parents about it and help them understand your house, grandma's house,
right,
anywhere the child is at during the day.
Allie, talk a little bit about what's coming up with the event later this year, and I think at the middle school.
Yeah, so in August, we're excited to partner and go to the ESL open house again. But this year it's going to be different because we're going to be giving immunizations, and we're going to be partnering with a group out of WSU, and they are going to be able to bring several different interpreters to speak the different languages. So we're excited to be able to provide those immunizations in a space where families are already comfortable, where they will already be, but also to be able to communicate with them the most effectively that we as the health department have ever been able to do.
Yeah, this is kind of, I'm watching this one really close because it's this resource that we have just north of us a little ways, especially with WSU. And they have people that actually speak the different dialects because, that Spanish alone just doesn't cut it anymore. It'll be really interesting. I'm looking forward to see just how this goes. They're excited about it, and coming down and helping out. So, they should be ready because this is and I think there's going to probably be a lot of promotion that will start up here pretty soon as we start talking to people about that. So
yeah, we're really excited for it. So it'll be cool to see how it all unfolds.
And I'm hopeful. Like I say, I'm hopeful that it will have a lasting effect. That will get people curious enough and comfortable enough to come in and find out a little bit. For some of them, it may be their very first time. We don't know. So that's kind of what we're looking to find out. All of it again is about suspending any kind of political connotations that come into it because I don't care. The people are here, and my job is to deal with it. And so for us, the best way is, until the folks in Washington can get their act together, make sure that our community is safe, make sure that the people here are healthy, and that the children that are entering our school systems or that are growing up in our communities are healthy. That's kind of where I come down on that. So that brings us up to the new school year. And let's talk a little bit about the health requirements for parents, especially if it's the first time or they've got kids going in initially to the programs. Talk a little bit about what they need to know and what they should be thinking about, because I hate to say it, every year they say, oh yeah, I've got time. And then we talked about how quick the time goes by. And then all of a sudden here they're up on a day and the time has passed. So get a little bit of encouragement.
Yeah, I'll actually let Tara start with what's required for pre-K, and then I'll kind of elaborate on that for the older grades.
Good.
We've talked about that a little bit with the physical. Again, we want kids to establish a medical and dental home, and we encourage them to have that first dental exam before pre-K. We have some amazing dentists that we work with and collaborate with, and everyone's just trying to do what's best for families and most importantly, the children. Then the immunizations, obviously the lead testing that we spoke about, and we have a health packet that families take home, and we explain why those things are important. Again, talk about if they have health insurance needs or areas of the community resources that we can help them with. Again, all a part of that enrollment process and us just gathering information about families. And then that ongoing health care as well. We do a lot of support for families if there's referrals to specialists or other things that come out of those medical appointments, and helping families to navigate that. We also provide transportation to those medical appointments, dental appointments, work with families if they need to go to Wichita. Again, a huge advantage of having family service advocates that are a part of that Head Start grant. And then I'll let you talk about K through 12.
Yeah, so K through 12, of course, there are some immunization requirements at various grade levels for that. Parents can find those requirements on our website. We have a little back to school page that lists all kinds of important things, including immunization requirements, school supplies, important dates, those kinds of things. And then also we just encourage them to check with the health department or their primary care physician on what their child might specifically need for the upcoming school year. And then just kind of a reminder that we have great resources in our schools and our school nurses. They're a wealth of knowledge and always happy to connect with our families and help answer questions and point them in the right direction too.
Allie, tell people how they can get those appointments made.
Yeah, so you can make an appointment by calling either of our offices in Arc City or Winfield. You can go ahead and use our mobile app if you wish, or you could just walk into one of our offices and we'll get you taken care of.
So that pretty much wraps it up. Have we missed anything on this episode? Something that you guys wanted to talk about that perhaps I didn't touch upon? Anything specific? Any messages you want to get out yet? You know, go Dogs and all that good stuff.
Yeah, I mean, of course, go Bulldogs. We're looking forward to the year. We've got an in-person enrollment opportunity coming up on, let me say the right date, July 25th. So if parents haven't already enrolled in the spring for this next school year, they can come into the buildings at any of the schools between 10 and 7 on that day and get some assistance. And current families, of course, can still go online to Power School and enroll that way. But we will have all of our schools open on the 25th to provide assistance. So
Good. Tara, anything else?
Thanks for having us. Just community partners are hugely important to our program and our families, and we appreciate the partnership.
Well, we enjoy it. You know, I've told so many others that come on to do this. This all started kind of as an offshoot of the communications challenges that we encountered during the pandemic. And we said, how do we go ahead and get to that point where we're talking to people a little bit more? And then it was like, well, you know, there's so much more in the community that connects to people's health and wellness other than just what the health department does. So anytime you guys have something like this that you want to help us get the word out or educate the community members in, please let us know, and we'll schedule another one, and you're always welcome to come on and join us in that.
And it doesn't have to be a full episode either. We do have a few episodes that are our trail mix episodes that are a little bit of this and a little bit of that. So we can make it work.
Those are some of the most fun ones.
Those are fun.
we ramble all over the trail in that one. But anyway, thank you very, very much for taking some time out today to join us, and we truly appreciate it. And as always, everybody that listens, thank you for giving us your time and attention. And Allie, until next time,
Stay well.
Stay well, everybody. Thank you. Thank you for joining us for this edition of For the Health of It, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. Packing up the boat and heading to the lake to spend time with friends and family is one of the great joys of summertime. However, it can also be quite hazardous. So here at the local health department, we want to provide you some tips to help you stay safe by the lake. Be prepared. This includes making sure your equipment is in good condition, leaving a float plan with someone you trust, and packing the right equipment, clothing, and supplies, especially sunscreen. Be informed. Before you head to the lake, know the local boating laws and be familiar with any particular hazards, especially currents. Also, don't forget to check the forecast. If you see bad weather on the horizon, get off the water. Lastly, wear a life jacket. Even the strongest swimmers can be overcome by tides and currents. A properly fitted life jacket can ensure that you stay afloat, and it may save your life. Keeping you safe by the lake is just one more way the health department works hard every day to help you stay well.